According to the Indian Psychiatry Society, India is witnessing an increasing number of mental health issues as it battles with coronavirus. As per the study, within a week of the lockdown, the number of reported cases of mental illness rose by 20% in India.
Since the outbreak of COVID-19, it's a state of paranoia. So I have to wash the toys and wash their stuff, and I clean it with use alcoholic wipes and all. When my husband comes from outside after grocery shopping, I don't let him meet my children for like 10 minutes. He has to come and wash himself up. And since my elder child is not been going to school, not been going to park, I'm worried about his mental development too, because sometimes he gets so emotional that I have to meet my friends, I have to go to park, but we cannot send him to the park. So that's also one part of this COVID-19, one phase of COVID-19 that we all mothers must be facing.
My studies have been disrupted for so long. Even though my studies are happening the online way, it's still not the same, especially when you have doubts. It's just difficult to study at the comfort of your home compared to what you study at school. I would just hope that the lockdown doesn't get extended so that I can go back to my normal school.
Experts believe this is just a beginning.
It's a twofold way regarding paranoia. Either people paranoid, especially who already prone to excessive hygiene, they are taking proper precautions and maintaining social distance, or they are completely disregarding them and are still in denial mode. It is again a kind of coping strategies to handle or maybe mishandle your situation, I can say. And slowly, as the cases increase, the paranoia is taking a curve.
On the other hand, Liberator Health and Wellness platform registered a surge of 110% in mental health queries, focusing largely on loneliness, stress, alcohol, mood swing, unemployment, uncertainty, economic hardship, and domestic violence.
Of late, we have also witnessed a rise in queries from working people around job losses in the country, as well as fear and worry about resuming offices at a time when COVID-19 cases are on the rise.
The highest jump has been witnessed from Mumbai, followed by Delhi, Pune, Ahmedabad, Chennai, Bangalore, and Kolkata. Among Tier 2 cities, the biggest jump in online consultation concerning mental health was reported from Indore, Lucknow, Kochi, Patna, Bhopal, and Bhubaneswar. The increase in the consultation was mainly by those in the age group of 25 to 45 years, followed by people between the age group of 45 to 60 years, and had more queries coming from women than men.
The platform witnessed over an increase of 150% jump for online consults around mental health issues for females, while the same number for males stood at 85%.
So my first advice would be stay positive, because your thoughts pattern leads your behavior. When you are staying positive, you will do positive, you will receive positive. Second advice from me would be stay informed, but from authentic sources only, like WHO website, or you can use Arogya Setu app from Indian government. But do not overexpose yourself or families to the news, because that is leading again to anxiety or maybe panics.
According to experts, social isolation and home confinement will have a worse impact in the near future, and therefore demands people to come together to address mental concerns by first acknowledging that during COVID-19, anxiety is completely normal.